Hi, this is Marty Stempniak, staff writer for Hospitals and Health Networks. Hospital finances are front and center as leaders look to shift to a model that's based on value for patients rather than just the volume of visits. Some argue that CFOs can't just focus on the bottom line in this transition and should make the patient's experience a key component of the movement toward value. I recently sat down with Joe Fifer, the new head of the Healthcare Financial Management Association, to hear his thoughts on value-based payment and the future of his new organization.
We are in an industry of human behavior. And what I mean by that is almost everything that's done in healthcare, again, it's not a mechanical process, but they're people delivering services to people. And then there's a financial element that's tied to that behavior. And so as we look to reshape the industry and look at processes, we're possibly changing or are changing either career-long patterns of behavior, career-long decision-making processes, and quite frankly, we're possibly impacting or are impacting, the financial stream that goes with that, which means that we're impacting livelihood. All those areas have deep emotional ties, and so it's just really important that we pay attention to that. We're cognizant of that, and some of that is through my own experience at Spectrum Health in Grand Rapids. As we looked at different payment models, the process that we went through and the discussions that we had went beyond just the mechanics or the financial analysis of what this would mean, but it's what does it mean to an individual physician and how they think. And so it's I think critically important that we pay attention to the emotional side of this change.
Next, Fifer talked about what he's learned so far since joining the association in June.
As I came into this position, I came in with a high level of familiarity both ways. Since I was chair only 5-6 years ago, the executive team and other employees knew me, and I knew many of them. So it's not been so much of a learning experience, but what I've really enjoyed doing is meeting people throughout the industry, meeting other association executives or other CFOs of both large and small systems, other people in the industry. That's been really fascinating. I've really enjoyed that.
And finally, Fifer shared his goals for the organization as it moves into 2013.
We just came off of several years' worth, and fiscal year 2012 was no exception of really solid performance. We have a balanced scorecard like most organizations do, and we hit on all of our balanced scorecard objectives or goals in this last fiscal year. So we come in from a position of strength. We're continuing those, and some of those metrics are things like membership growth, membership satisfaction, education satisfaction, things like that. Employee, how do we have a process to evaluate our employee satisfaction. And all those are still in place. But the different thing this year is that we're going through a disciplined process internally and with our board to really take a look at HFMA with fresh eyes. Dick was here for many, many years and was just a phenomenal leader. And in talking with him, he even said, what the association could really use as a fresh look as the industry is going through all these changes. And so that's exactly what we're doing is we're going through a disciplined process to look at what are the things that we do, what are the products that we have, what are our membership services, what's our membership itself, just taking a crisp, clear, clean look at it at HFMA, and again the metaphors with fresh eyes to see which direction that we should go in the future.